When comparing a cheek implant and fat transfer to Voluma, how many syringes would you need to get comparable results? For the average patient considering a cheek implant, how much Voluma would it take to recreate the look you can get from an implant? My surgeon keeps saying you only need 1 cc per cheek, but that's not a lot of filler, so I'm curious why anyone would want to get fillers every 2 years when you can get a fat transfer or an implant that are technically permanent. Does Voluma give more noticeable results than the volume of the syringe would suggest? How much does technique matter as well?
Thank you for your question. You're asking a question about volume when it comes to recreating or creating the effect that you would get with a cheek implant with an injectable filler versus fat transfer, and you're asking if there are more permanent solutions for cheek volume. Why wouldn't someone choose a more permanent solution such as a cheek implant or fat grafting as opposed to getting filler as you would describe every 2 years? And then you end your question with, does technique matter? Well, certainly I can discuss this for hours, but I'll give you certainly an overview as to how I counsel my patients who ask exactly the same question pretty much every day in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform all those procedures you described, everything from cheek implants to fat grafting, as well as the use of injectable fillers. So I can share with you basically what my own personal evolution has been in determining what I think is the recommendations, or that inform the recommendations I make to my patients every day in my practice. So to begin with, it's very important to understand that the concept of permanence is a fleeting concept because our faces continue to change. And it basically, in terms of an evolution, I would say that before we had such a good variety of injectable fillers, my natural inclinations, particularly as a surgeon, was to recommend the placement of cheek implants, and then well into the early to mid-2000s, as well as offer fat grafting, which once the longer lasting fillers came along, it evolved, and I'll explain why. As I said earlier, permanence is really not truly a long-term solution, because when you think about, quote, permanent solutions, you can look at people who had silicone injections done 20 years ago and how they look now. You can look at people who had fat grafting 10, 15 years ago and now. You can appreciate that facial aging is a progression of volumetric loss, most significantly at the bone level. And because it's at the bone level, it's very important to understand the impact it has on facial structure. Now, certainly cheek implants is certainly a very good strategy when it comes to providing volume correction. However, when we think about the options of, let's say, a cheek implant versus fat versus filler, well, it also has to do with relative indication based on skin thickness and the amount of the type of individual we are treating. So when it comes to the solutions that patients ask me for, I've ultimately gravitated, and I've seen a very high success rate with something called structural volumizing. And the point of my making that statement also has to do with the lifestyles of our patients. When I was in training back in the 90s, I recall that my preceptors, who were amongst the top cosmetic surgeons in the country were essentially of a particular mindset where the type of patients they were treating as a large percentage were people of significant affluence who would undergo a lot of procedures and then hide for weeks and weeks and weeks. Move the clock forward, and the modern patient is often, even if they are, whether they're affluent or not, they're very busy and they have a lot of responsibilities and they cannot hide for weeks and weeks and weeks. So in terms of lifestyle and in terms of predictability, there is a high premium to getting the optimal procedure and with minimal risk and maximal predictability with almost no tolerance for complications. So when you think of the equation in that respect, we also have to think of the equation in terms of the level in which fillers are placed. A lot of times, people who go for the, quote, permanent solution of fat grafting are very disheartened by the lack of predictability of fat grafting. And in spite of significant improvements in the processing of fat after harvesting, there's still a significant unpredictability to fat grafting in my experience and my opinion. So between fat grafting, which is also, and fillers, fat grafting and fillers are typically placed just below the skin in the soft tissue of the cheek. What that unfortunately can result in is a rounding and an overfilled, exaggerated, unnatural look. This is where structural volumizing comes into play. If we use the same principle that's applied for placement of a cheek implant, which is placed directly on the bone structure, and we use that same concept, but place filler that has a certain thickness to it on the bone structure between the bone and the muscle, well, then you can get an effect that's comparable to a facial implant but by avoiding surgery and avoiding the potential issues related to placement of facial implants, you can get essentially the most predictable outcome with the lowest risk. So further, a lot more people are willing to undergo fillers than are willing to undergo cheek implants. So when it comes to my practice currently, we do a lot of structural volumizing. And to be more clear, essentially what I'm using is a special instrument to place a thicker filler, such as a Juvederm Ultra Plus or Juvederm Voluma, at the bone structure level. I'm able to enhance the cheeks, the jaw angle, the chin, the jawline. And I can do all this in a matter of minutes, such that someone can have the results that can look like they've had a facelift without undergoing surgery. And that is a significant advancement in the whole strategy of helping people look their best in the least amount, with the lowest risk and the least amount of time. So in the closing of your question, you asked, does technique matter? I would say absolutely. Technique definitely matters. So I think it's important that you learn this in terms of your strategy, depending on what is right for you. If you're more amenable to having cheek implants, certainly that's a very viable, appropriate option. I would probably discourage you from fat grafting because of the challenges with predictability and asymmetries and irregularities. But again, that's my opinion. And I would say that for most of my patients who come to my practice and have a similar type of concern, we pretty much always end up going to structural volumizing and getting the results that in so many ways is so convenient to a patient's lifestyle that it's hard to choose something else. So learn more about these options, including the concept of structural volumizing, which will further, I think, enhance the depth of your understanding of the role of injectable fillers and why very, very rational, smart people choose something like structural volumizing instead of a, quote, more permanent solution. So I hope that was helpful. I wish you the best of luck. Thank you for your question.